Hello, I'm Dr. Mahadevan, one of the doctors in the GP surgery. So, are you Mr. John Bennett?
Yeah, doctor.
Yeah. So, can you please confirm your age for me?
Yeah, doctor, I'm 36 years old.
Okay, so nice meeting you, John. So, can I know what brings you here today?
Oh, doctor, I'm really worried. It was like a week or 7, 8 days ago. I was in Turkey, like on a vacation trip, and there was a cat, and it suddenly, jumped on me and bit on my arm. And I got really worried, would it turn into something serious or not? That's why I came here.
Oh, that's very worrisome. You're on your holiday and this happens. It's really hard for you. I'm really sorry for that. So, John, please don't worry. We are here to help you. We'll see to it. So, before that, can you just tell me more about it? Where exactly did it bite you? And how is the wound right now? What did you do immediately after?
Yeah, doctor, I was in the park. Okay, I was just sitting on a bench and there was a cat. I didn't provoke it or, there was nothing like going on. It was a normal routine day and it suddenly jumped on me and bit on my forearm. And, it was like a kind of, it broke the skin. It was some blood oozed out. And I got really worried and I washed it immediately.
Oh, that's really good that you washed it immediately. So, did you visit any hospital or what did you do after that? What did you do to stop the bleeding?
Yeah, doctor, after washing it, the bleeding kind of stopped, but, to be sure, like whether it's something right or wrong, I went to the hospital, emergency setting, and they washed it with something called saline, warm saline, and they also gave me some painkillers for it.
Okay, that's good. So, how are you feeling right now? Do you have any fever, pain, nausea, or anything that I should know about?
No, no, doctor. Sometimes there's some pain, but no fever or like vomiting.
Okay, that's okay. So, I would just like to ask you a few questions just to know about your medical history better. Is that fine, John?
Sure.
Yeah. So, is there any medical conditions or medications that you're taking that I should know about?
No, sir, no, doctor, nothing like that. No regular medications.
Okay, are there any medicines that you're allergic to?
Nope.
Okay, so is there?
Sorry, doctor. I just found out. Sorry, recently, my GP told me that I was allergic to penicillin. Yeah.
Oh, okay. So thank you for saying that to me. I'll keep that in mind. So, about your social habits, do you smoke or drink?
Occasionally, doctor. There was like not. I'm not a chain smoker like that. Occasionally, my friends, when friends come up to meet you.
Yeah, okay. So, John, is there anything that I should address in this consultation? Is there anything for you to share to me? Anything that I should address specifically?
Yeah, doctor. I was really worried. Would this wound get infectious or spread, or like, is there anything vaccinations required for it? Because I've heard like dogs and cats, they call rabies. So I was really worried about that.
Yeah, that's a really valid concern, John. So don't worry, we look into it. So, can I know about your vaccination status? Have you taken any recent vaccines, or how is it? Is your tetanus vaccine up to date?
About my tetanus vaccine, like I've got the doses, 5 doses in the last 1 year. Like the last dose was almost 12 months back.
Okay, so any idea about your rabies vaccination?
No, no, doctor, I don't have any idea about that.
Okay, okay, don't worry, we'll look into it. So, John, do you mind if I just take a look at your wound so I can get a better idea of it?
Yeah, sure, doctor.
Yeah. Okay, John, so I just took a look at your hand and it's just a small wound with some redness around it. and don't worry. So, as you mentioned that you have some concerns about your infections and things like that, so we'll be starting an antibiotics for you called doxycycline and metronidazole. That is because you said you're allergic to penicillin, so these are safe to use. So you'll be using it for 3 days, and this will prevent from any infections coming because of the bite. And we can also we'll be cleaning the wound and doing a proper dressing. So what do you think about it?
Okay, doctor, as you said, I just want that the wound doesn't fester on my skin. So whatever you say,
Yes.
doctor.
Yeah, so this will be really helpful for that. And we'll also, you can take some paracetamol or ibuprofen for your fever or pain. And
Two
but
minutes
as you
remaining.
mentioned, that your vaccination is up to date, your tetanus vaccine. So I think we need not repeat it, it's not needed for you. And regarding the rabies vaccine, I'll just consult with my senior and let you know. How does that sound?
Okay, sure, doctor, sure.
Yeah. So, meanwhile, we'll just give you some pamphlets to just read about cat bites and know what exactly can go wrong with it. So you'll be well informed. And if ever you experience any pain, any swelling, or any fever, nausea, or anything like that, please do come to us or just call us immediately, right?
Okay, doctor. Okay, doctor, I have one question. Like, is there any need for a follow-up or anything like that?
Yeah, we'll just call and we'll just ask you how you're feeling at the moment, and that's like a follow-up. So if you have any disturbances, you can let us know. Other than that, I think it should be fine because the wound looks quite clean and it's okay. With the dressing and antibiotics, I guess you'll be fine.
Okay, thank you, doctor.
What do you think about it?
Thank you.
Okay, so thank you so much, John.
Please like and subscribe to Turing Med School. Good luck with your preparation.